Let's just start.
Okay. Okay, Assalamualaikum warahmatullahi wabarakatuh and good morning to all ladies and gentlemen. Okay, welcome to the International Scientific Webinar Series organized by Persatuan Pegawai Sains Malaysia, PPSM, the first ISW mark on May 2023, and since then, this webinar series has featured various topics from various fields of sciences. Okay, today I am Sazalia binti Ishaq, will be the moderator for today's ISW webinar series. The title is Drug of Abuse Testing in Ministry of Health Malaysia and its Challenges. Okay, first of all, I want to briefly introduce our guest speaker, Dr. Nordiana Rosli, a clinical biochemist from Department of Pathology, Hospital Kuala Lumpur. Okay. Dr. Nordiana obtained her Bachelor of Science with Honours in Biochemistry from University Putra Malaysia in 2004, followed by a Master of Science in Quality in Analytical Laboratories under the prestigious Erasmus Mundus program at the University of Barcelona, Spain in 2015. She later earned her PhD in Bioanalytical Science from the University of Science and Technology, USC South Korea in 2023. Dr. Nordiana has over 15 years of experience as clinical biochemist in Ministry of Health Malaysia. She is currently working at Drug and Toxicology Laboratory, Pathology Department, Hospital Kuala Lumpur, where she is focuses on the research, development and validation of analytical methods for drug of abuse testing using GCMS and LCMS technologies. Her previous working experience was at Hospital Tengku Ampuan Afzan Kuantan, Hospital Sultan Haji Ahmad Shah Temerloh, and Hospital Kuala Lumpur, where she's contributed extensively to biochemistry, hematology, and toxicology testing. In the research domain, Dr. Nordiana has been actively involved in several international collaborations, producing impactful publications in journals such as the Journal of Chromatography, Analytical Chemistry, Scientific Reports, and Journal of Clinical Laboratory Analysis. Her work encompasses measurement standardization, therapeutic drug monitoring, and bioanalytical method validation. She has also presented her research at numerous local and international scientific conferences, including the Malaysian Association of Clinical Biochemists Annual Conference, the Korean Society for Mass Spectrometry, and the Analytical Sciences Biannual Conference. Currently, she also serves as a principal coordinator of the Research Committee for Scientific Officer Biochemists at the Ministry of Health Malaysia. It is indeed a great honor that she is able to deliver a talk for today's session. Thank you very much, Doctor, for accepting our invitation. Now, I would like to invite Dr. Nordiana to deliver her talk today. Over to you, Doctor.
Okay, thank you, Sazalia, for the kind introduction. So today I will talk about drug abuse testing in Ministry of Health Malaysia and its challenges. I want to know, can you see my presentation?
Yes.
Okay, so I'll just start. First of all, I want to thank the PPSM for giving me the opportunity to give today's talks. So I'll just proceed talking about the topic that I've been assigned today. An overview for today's talk that I will talk about the MOH role in DOA testing, and as well as legal testing workframe, analytical workflow, as well as the key challenges in the drug of abuse testing in the Ministry of Health of Malaysia. So from this is the graph of the prevalence of drug use in the general population of Asia, and in the red marked circles, it is shown the breakage of the type of drugs that are being abused in Southeast Asia and East Asia. So basically, the highest number of drug prevalence is cannabis, followed by the amphetamine type stimulants, and then ecstasy, opiates, as well as the cocaine. So following the trafficking methamphetamine flow from the UNODC information, that is the United Nations Office on Drugs and Crime, we can see that the Southeast Asia, we have a very high volume flow of methamphetamines. So in Malaysia, we deal more on the ATS, amphetamine type stimulant, compared to the other drugs. So going back to the work talk frame, what is the MOH role in this legal drug abuse testing? First of all, under the lab and toxicology lab, Department of Pathology HKL, we mostly help the law enforcement agencies requests in doing drug abuse testing. This is mostly comes from the request from the police department, as well the National Anti-Drug Agency, as well as the army. So other than that, we also do clinical toxicology monitoring, which is under the hospital. The clinicians that wants to do any clinical toxicology monitoring, they will send the request to us. We also do some workplace screening, but this is mostly done under the provision of the National Anti-Drug Agency, the AADK. And for your information, all of our drug abuse testing is being conducted under the pathology laboratories all over Malaysia. And our report are legally admissible in court, that is being used to do some enforcement under the Dangerous Drug Act, as well as Drug Act under the Treatment and Rehabilitation. For us, for DO testing, we are not involved in any of forensic cases. For the forensics, they are mostly sent to the chemistry department for testing. So we only handle drug abuse testing in terms of Dangerous Drug Act, as well as the Treatment and Rehabilitation Act. So in Malaysia, we have around like 112 hospitals that does the drug abuse testing. This is inclusive both in the peninsula as well as on the Borneo island on the East Malaysia. So what is the workflow for drug abuse testing? Basically, for sample handling, we do not handle the sample taking, but it's more of like receiving the samples that had been collected by the enforcement agencies, and we only for now is able to cater only for urine samples. We do not offer any testing for other biological samples, for example hair or saliva. For us under the ministry, we adhere to a very strict chain of custody, where whenever we receive the samples and processing, and also giving away the report, we have a strict chain of custody, and everything is well documented. When we receive the samples, we will first do screening testing, and then we do a confirmatory analysis if the screening testing is found to be positive. And our screening test, we use a immunoassay method, which is like because it is able to produce rapid and as well as a high throughput. For Confirmatory testing, we use several types of method depending on the designated labs. For now, we are still using thin layer chromatography. We are also using gas chromatography as well as liquid chromatography, MSMS. So for confirmatory analysis, we do a definitive identification as well as quantification. But in our report, we only do a qualitative reporting, not a quantitative reporting, even though we do a quantitative analysis. So what are the common drugs panels that are being done in Malaysia? We mostly do the drug abuse testing based on the Drug Act. And for now, under the MLH, we only report for morphine, for TAC, that is cannabis, amphetamine type stimulants such as amphetamine, methamphetamine, as well as MDA, MDMA. We also report on ketamine, benzodiazepine, specifically for nimetazepam, as well as flunitrazepam. And we also offer for mitragynine, but this for this analyte, it falls under the Poison Act. It doesn't fall under the Dangerous Drug Act. So currently for confirmatory testing for morphine and HC, and overall in Malaysia, we have 29 labs that does this confirmatory testing, and each state has at least one lab that can do the confirmatory test for morphine and THC. For year in 2022, the workload for screening and confirmatory testing for morphine and analysis is between almost 70,000 for screening test cases, and the confirmatory test is about more than half, like 35,000 cases. And so the for TAC, we have about 45,000 cases and only around 7,000 plus for the confirmatory testing. Moving on, as I mentioned previously, in Malaysia, we have a high number of ATS testing, but however, for confirmatory testing for amphetamine type stimulant, we only have 9 labs and in Malaysia. And for the East Malaysia, we have 3 labs that offers confirmatory testing. There is one in Queen E, Duchess of Kent, as well as Hospital Umum Sarawak. Meanwhile, in the peninsula, we have another 6 labs that is in the Sultanah Bahia in the northern region, Hospital Kepala Batas in Penang, Hospital Raja Perempuan Zainab II in Kelantan, in Terengganu, Hospital Sultanah Nur Zahirah, as well as in the southern region, Johor, Hospital Sultanah Aminah, as well as the middle region is Hospital Kuala Lumpur. For the number of workload that we have to do for ATS analysis, back in 2022, it was about almost 140,000 cases. And 73% of this are screened to be positive, and we move forward to do the confirmatory testing using GCMS. So you can see from the slide that for HKL alone, we have back in 2022 almost like 45,000 cases, and confirmatory testing almost more than that, because we considered the backlog from the previous year. So there's a lot of cases that goes through in HKL, mainly because we handle not only the Klang Valley, we also handle the other 5 states nearby, neighboring HKL, neighboring the Klang Valley, which is like Selangor, Negeri Sembilan, Melaka, and Perak, and some part of Pahang. And for ketamine, confirmatory testing can only be done at 3 hospitals, which is one in the East Malaysia, is in Sabah, which is like the Hospital Queen E, and as well as the Duchess of Kent. And in the Peninsular, only Hospital Kuala Lumpur does the ketamine analysis. So the workload falls for ketamine for Hospital Kuala Lumpur is around 2,500 back in 2022, and the confirmatory testing is around 1,300, which is like 37% of the overall cases that we received back in 2022. So, so for ketamine analysis, we also uses GCMS. Okay. So for moving forward, we also in HKL offer multi-drug. What multi-drug means, like we have 45 parent drug and as well as analytes. This is inclusive of benzodiazepines, opiates, TAC, as well as mitragynine. And for the time being, only Hospital Kuala Lumpur offer this test because we do this testing using an LC-MS-MS method. So back in 2022, the multi-drug analysis we received cases is around 2,600. And we don't have a screening method for this. We just do the analysis testing through the LC-MS-MS. No screening has been done. Just immediate quantification through LC-MS-MS. So moving forward, in 2023 to 2024, we started collecting the national levels lab turnaround time for drug of abuse testing. And for morphine and cannabis, there is around 21 in 2023 and 20 labs in 2024 that does these morphine and cannabis testing. This is inclusive screening and as well as confirmatory. And the test method is the thin layer chromatography. And we receive a workload of around 33,000 and 30,000 per year. So on average is around 30,000 per year. And we have to produce this report within, for morphine, it is supposed to be within 7 to 14 days. And we were able to achieve around 97% or 95% of lab turnaround time for morphine and cannabis. Meanwhile, for ATS, where the 9 hospitals that can offer, inclusive of the morphine, cannabis, and ATS, using the GCMS method, we receive around a workload of like 170,000 cases, and average between the two, maybe around 170,000 cases per year. And it's unfortunate that we are not able to produce the report within 30 days. We are only able to produce the drug of abuse testing less than 30 days, only at 40 to 45% on average yearly. This is due to the massive number of workload that we have to handle, as well as the limited resources that we have. I mean, like the limited number of hospitals that can cater to the request. So this one I will talk more further in the soon later. And I want to mention about the quality and oversight structure of the service. So under the Ministry of Health, we have a, drug of testing guideline that we disseminate for all of the MOH lab, and then we use this guideline to run our drug of abuse testing. If you are interested to read about this guideline, it can be found online under the Ministry of Health website. It is the guideline for drug abuse testing under the MOH. We also have a national drug quality control program, which we handle ourselves. This is due to if we have to use an overseas EQA, it is most of the time that the drug panel are not catered to the demand of of Malaysia. So this is the reason why the HKL takes the initiative to do the EQA program, catering to the needs of our national levels drug panel. So for the drug testing labs, we also have the ISO 15189 accreditation. And for HKL, we also enters the national international EQU programs such as the College of American Pathologists, CAP, as well as the United Nations Office on Drugs and Crime, UNODC. So we basically, under the HKL, we have 3 EQA that we join for our quality program. So all our reports are legally defensible through the chain of custody and validation documentation. So most of our officers that sign and do validation of the report, we are subpoenaed to the court and to give testimonial for any legal action that need to be taken for the drug users. So basically, what are the challenges that we have to face for the drug abuse testing in Malaysia? Mainly, one is the quality assurance challenges. As I said before, we have a limited affordable EQA program, which is not very aligned with the common drug panels in Malaysia. Maybe another country, they have more intensive and extensive drugs testing, but in Malaysia we are not monitoring them, or it is not a very common drug abuse in Malaysia. Therefore, we decided to have our own EQA program that is more aligned to the local drug abuse panel, as well as catering the needs sample volume for our labs in Malaysia. For this EQA program, we offers it for free because international EQA program can cost a lot, and the logistic hinders the participation, especially for the smaller MOH labs. So another challenges that we have to face is, for example, whenever the enforcement agencies uses strip, they might have some cross reactivity that might produce a false positive. When we have not so good strip being used, or very high cross reactivity, the increased number of requests sent to us is more. So it means that we have to screen more and then do the confirmatory testing afterwards. And another challenge that we are facing is with the new emerging synthetic drugs, the new psychoactive substances, the immunoassays that we are using for screening, they are not able to detect them. And we are also don't have the confirmatory testing for this MPS. It's unfortunate. As well as we do have a constraint on reference materials because it can be very, very expensive for reference material for us to do quantification, as well as because of the high workload, we have to um, extend our turnaround time because most of the work done in the drug lab are manual work. We don't have any automation yet, and most of our analyzer are old analyzer. Some of them are more than 10 years, but we are still using them. So in terms of operational and logistic challenges, we also have limited trained personnel and drug abuse. This is the reason why, because we use this high-end equipments in drug abuse, which is like GCMS, LCMS, and for people to use this kind of technology, we need to train them, and it's not as easy as giving a 1 day course. So a continuous training need to be developed so that we can proper train all the staff under the doing the DOA. We also have the high workload with a short reporting timeline. That is why and we cannot produce our lab report within the stipulated LTAT. So as I mentioned again, the instrument aging and maintaining costs, it's quite a burden, especially under the Ministry of Health, where we are more catered for patient care. But our most of our workload are from the enforcement agency. So there is also a problem of procurement delays in terms of chemical kits and standard, especially standards, because it is not produced locally. We have to bring it in from overseas. So throughout the documentation and shipment, so we do have a problem of getting the standard within the time needed. Another operational challenge that we face as the limited LIS integration in the lab, as well as between sites and agencies. For now, we don't have any LIS interfacing with our analyzer in the lab. Therefore, our reporting are mostly done manually, and there is no interfacing of test requests from the enforcement agency. So everything is being done manually, and we have to do the demographic into the system, our LI system manually, and as well as the data sheet for testing analysis into the analyzers manually. So, what are the other emerging issues that we have to face? First of all, I think everybody is well aware of the rising use of the new psychoactive substances. For example, maybe in the general public, is more well known as magic mushroom, and as well as maybe you have heard of itomidate, which is a problem, a big problem in Singapore, but they have countered that with the use banning of vape into Singapore, as well as the emerging of a new opiate-based synthetic opiate-based drug, that is anitazine. I'm not so sure if netazine is has been detected in Malaysia, but it has been reported in European countries as well as in Australia, I believe. So the emerging NPS, they also introduce a novel drug delivery form, such as a vape liquid, gummies, and also candies. So this is like mostly are have been reported on the news. And another emerging issues, as I mentioned before, is the analytical and instrumental gaps. So for us to develop NPS analysis, we have to have high-end equipment such as LCMS MS, but unfortunately for us in MOH, we only have one for DOA, the current one that we have, which is like in aging equipments already more than 10 years. And we are unable to do any method development due to limitation of the instrument. So because the instrument now runs 24/7, and we have a backlog for more like 6 months doing the multi drugs. And there is also a need for national data harmonization. As I mentioned before, the data that I presented to you, we only start to properly collect the information starting from 2022 and 2023 and 2024. So hopefully going forward, we can better harmonize our national data collection. So what has been done to counter all the challenges that we have faced? First of all, for instrument replacement, although we have year by year requests for a new equipments, but sometimes due to um, the priority of healthcare under the Ministry of Health, we are unable to get the equipment. But the way that we do is like instead of buying new equipments, we propose for leasing. So in drug lab now, we are moving forward with leasing equipment instead of buying equipments. So in terms of capacity building, we do like yearly continuous training for DOE analysis. So for example, in 2023, we did national level for back to basics for DOE testing, and also continuously doing training for GCMS and as well as LCMS. So another point that we do for continuous improvement is we do the standardization and quality enhancement in terms of NDQCP improvement. For the EQA program, year by year, we increase the number of participation, meaning increase the number, the availability of EQA program that we can offer to the hospital. So we increase the number of participation as well as the number of drug panels that we offer in the EQA. So another point is we have the improvement in terms of digital and data integration. So for HKL, we have around like 6 GCMS and 1 LCMS. But unfortunately, our analyzers, GCMS and LCMS, is not interfaced with our LIS. So going forward, we are now in the works of interfacing our analyzers with LIS so that our reporting can be done faster, as well as we are able to um, lower our turnaround time to like less than 30 days for all our reports. So in conclusion, so for DOE testing under the ministry, we provide a legal report that can be used for not only clinical monitoring, we also helps the rehabilitation as well as enforcement agencies. So our officers basically had been subpoenaed to court maybe at least 3 to 4 times in a month. So another challenge is to remaining in terms of technical capacities. So we hope that with whatever limited um, further improvement that we can do in terms of technical and quality harmonization, as well as resource sustainability, we can improve our service in the future. We also focus on technology as well as competency in strengthened in terms of our national DOA testing. So basically, that is all I can mention about our drug abuse testing in Malaysia. So if you have any question, please feel free to ask. Okay, that's done.
Okay, thank you so much, Doctor, for an interesting talk. If anyone has any question, I'm sure Doctor would be pleased to answer them. Please feel free to post your question on the chat box, or you can unmute to ask directly to our speakers today. If there is any question from the participant. Okay, Doctor, I want to ask a question. Is it the NPS drug will be offered in the future at Hospital Kuala Lumpur?
Okay, currently we don't have the capacity nor the equipment for NPS testing. However, if we are able to get new equipment, especially SCMSMS, we might be able in the future, but for the time being, we are not able to offer the NPS testing, especially for example, the magic mushroom. It's unfortunate. Yeah.
Is it other agencies can do the drug testing besides on the MOH?
Currently, if I'm not mistaken, the only agency may be able to do the NPS testing is under the chemistry department. But if anybody wants to send in NPS testing, you have to contact with the chemistry department and ask them first, because whether they are able to cater to your request or not. No question?
Okay,
Nadi?
at the chat box, we have no question at the chat box. Okay, if there is no question in the chat box, I think we can end our session.
I would say thank you so much for giving me the opportunity. So if you have any question you want to ask later, you can contact me at the Drug Lab HKL.
Okay, Doctor. Thank you very much, Doctor. So we
Thank
end our
you.
session now. Thank you all the participants. Feel free to kindly to fill the attendance at the chat box. We already sent the link